Hi, this is Dr. Michael Ryan with Missouri Vein Care. I'm answering a question that patients ask me, which is, when will a vein condition go away, and will it ever go away on its own? And the answer is sort of yes and no to that. The short answer is that a vein condition never completely goes away once it gets started, but some of the symptoms and some of the isolated um, visible findings can go away. One of the scenarios that we see is a patient has a very sore vein in their leg, um, and it's red and angry. And what that represents is phlebitis. That's inflammation of the vein. And really, what it represents is the vein has closed off on its own spontaneously, and it gets filled with blood. The blood is trapped inside there, and it causes a inflammation reaction, which is very uncomfortable and usually lasts several weeks, up to even a month. During that period of time, there can also be a red streak, which is very alarming for people. If that happens to you, really, you do want to get in to get a vein ultrasound to make sure you don't have a deep vein thrombosis, which can accompany that condition. Uh, but in that case, that vein that was giving them trouble has closed down, and very often it completely shuts down permanently. Sometimes that vein will open back up on its own spontaneously, what we call recanalizing. So it's difficult to completely predict, and it needs to be checked on with a follow-up ultrasound. If you were to develop that, then a complete vein ultrasound would be the way to go to sort out all the vein irregularities and to keep track of what's what over time. The other scenario where a vein condition can improve, but it doesn't completely go away, is during pregnancy. The veins often become very dramatically enlarged, very painful, and that is a result of the hormones of pregnancy, which the hormones of pregnancy are designed to expand the blood volume to allow blood to be delivered to the placenta. So the blood is delivered to the placenta with the expanded blood volume, and the result also is the veins get big. And so the hormones of pregnancy also result in dilation of the veins to allow this increased blood volume. And so the veins can become quite large, and you can get a lot of varicose veins during pregnancy that actually significantly diminish or go away after pregnancy ends. Most patients will notice that that is improved after they deliver their baby, but the veins don't completely go away. And once the vein is there, it just gets worse every year. It gets more enlarged. It extends in its dimensions. It goes up and down the leg. So once you have a vein in your leg that's abnormal, it will slowly at some point become more prominent, bigger, and extend up and down your leg. So that is the scenario where a woman will get improvement after pregnancy, but it won't completely go away. So Dr. Mike Ryan answering the question, when will a vein condition go away, if ever?